Here's a number that surprises almost every patient I mention it to. Somewhere around 1 in 10 people on a statin will report a symptom to their doctor that has nothing to do with cholesterol at all, and most never connect it back to the pill they're taking every night. I'm not talking about the side effects listed on the pamphlet. I'm talking about something quieter, something that builds slowly enough that people blame it on aging, or stress, or just getting older. And by the time they figure out what's actually going on, they've usually been living with it for months. So, today, I want to walk through what's really happening inside your body when you're on a cholesterol-lowering medication. Not just the headline stuff, but 3 things that don't get talked about nearly enough. And I'm going to end with a simple blood test that most people have never asked their doctor for. One that could actually explain a lot of unexplained fatigue in people on these drugs. Now, this matters more than it might seem, because cholesterol medications are statistically one of the most widely prescribed classes of drugs on the planet. Think about that for a second. A huge portion of adults over 50 are walking around with this compound quietly altering their cell chemistry every single day. And yet most of us learned almost nothing about how it actually works beyond it lowers your numbers. I've spent years in clinical practice managing patients on these medications, watching what actually happens in the real world versus what happens in the textbook. So I want to be upfront. I'm a physician, but I'm not your physician, and nothing here replaces an actual conversation with your own doctor. This is education, not a prescription change. Let's start with the mechanism, because it actually explains everything else. Statins work by blocking an enzyme called HMG-CoA reductase. Think of it as the main gate in a factory assembly line that produces cholesterol in your liver. Block the gate, and less cholesterol gets made. Simple enough, but here's the thing. That same assembly line also produces a molecule called CoQ10, which your mitochondria, the energy factories in nearly every cell in your body, depend on to actually generate usable energy. So when you shut that gate, you're not just slowing cholesterol production, you're potentially slowing CoQ10 production too, in every energy-hungry tissue you have: muscle, heart, brain. So, point 1, muscle symptoms. Research suggests a meaningful minority of people on statins experience some degree of muscle aching or weakness. And the leading theory ties it back to that CoQ10 disruption I just mentioned: mitochondria in muscle tissue running low on fuel. I think of it like a car engine trying to run on watered-down gasoline. It still moves, but it struggles, it feels labored. And practically, if you've started a statin and suddenly your legs feel heavier on your usual walk, that's worth mentioning to your doctor rather than pushing through it. Point 2, and this one catches people off guard: a modest increase in blood sugar. Statins appear to have a small effect on insulin sensitivity, the efficiency with which your cells respond to insulin and pull glucose out of the bloodstream. For most people, this effect is minor, but in someone already sitting near the diabetes threshold, it can be enough to tip the scale. I've had patients who were shocked to see their fasting glucose creep up a few months after starting therapy, with nothing else in their life having changed. It's not a reason to avoid the medication. For most people, the cardiovascular benefit still outweighs this. But it is a reason to keep an eye on your numbers if you're already borderline. Point 3, the liver conversation, which honestly gets more anxiety than it deserves. Statins are processed through the liver, and in a small percentage of people, liver enzymes rise on blood work. Here's the myth bust: years ago, doctors used to order liver panels every few months for anyone on a statin. Current practice has actually moved away from that kind of routine monitoring for most patients, because significant liver injury turns out to be quite rare. So if your doctor isn't ordering constant liver tests, that's not negligence. That's actually where the evidence has landed. And there's a 4th, smaller thing worth knowing. Certain statins are broken down by an enzyme system called CYP3A4, and grapefruit juice can interfere with that enzyme. For a couple of the more affected statins, that interaction can meaningfully raise drug levels in your blood. It's a narrow issue. It doesn't apply to every statin. But if you're someone who drinks grapefruit juice regularly, It's genuinely worth a 2-minute conversation with your pharmacist. Now let's talk about what's overrated. First, the idea that natural cholesterol supplements, red yeast rice being the classic example, are a gentler substitute. The active compound in red yeast rice is chemically almost identical to a statin. So you're not really avoiding the mechanism. You're just avoiding the regulation and dosing consistency. Second, the belief that stopping a statin the moment you feel any muscle twinge is always the right call. Sometimes the timing is coincidental, and abruptly stopping without medical guidance can leave cardiovascular risk unmanaged. And I'll add an honest caveat here. A lot of what we know about milder statin side effects comes from observational data and patient-reported symptoms, rather than tightly controlled trials. So some of this picture is still being refined. Which brings me to the bonus. The test I mentioned at the start. If you've been on a statin and dealing with fatigue, low energy, or those achy muscles we talked about, ask your doctor about checking your CoQ10 levels, or at minimum a creatine kinase test, which measures muscle enzyme leakage and can help distinguish ordinary aging aches from an actual medication effect. It's a simple blood draw. It's not routinely ordered, and for the right patient, it can genuinely reframe months of unexplained tiredness. I hope this was helpful. Stay healthy, and I'll see you in the next one.